Currently, 7 million Americans are affected by Alzheimer's disease, and it's estimated over 13 million will be afflicted by the year 2050. Dr. Cordula Dick-Muehlke of Hoag Memorial Hospital Presbyterian in Newport Beach explains Alzheimer's disease and where to get help.
Alzheimer's is a neurodegenerative disease that affects primarily the brain. Alzheimer's accounts for 70% or more of all dementias. A dementia involves loss of intellectual ability, affects your memory and one or more other cognitive abilities such as language, reasoning, judgment, and the impairment is so severe that it interferes with your ability to carry out your normal activities. So at first it might be work or your social life, and eventually even to do your own basic self-care. Scientists understand the changes that occur in the brain, but the starting point or the cause of those changes still remains a mystery. In the preclinical stage, which can last years or even decades, brain changes are occurring, but there's no or very minimal outward evidence. As those brain changes progress, however, we start to see significant changes in the person, especially with forgetting recent information. We can also see apathy, depression, other symptoms during this stage. As the brain changes continue to worsen and become severe, the person can then transition into Alzheimer's disease.
And how is Alzheimer's diagnosed?
It's important to recognize that there's no single test for Alzheimer's disease. Memory loss can be due to any number of causes. Just even medication side effects can cause confusion. So we want to make sure that a thorough evaluation is done, and that would include physical and neurological exams. Blood tests would include brain images and would also include testing of mental or cognitive abilities.
Dr. Dick-Muehlke explained the treatments for Alzheimer's.
In terms of medications, there are now 4 FDA-approved medications for Alzheimer's disease. All of these work on the chemical changes in Alzheimer's, and as a result can create some improvements in cognitive and everyday functioning. It's really important that we detect the disease early, though, because these drugs are most effective in the early stages.
We ask how Alzheimer's can be prevented.
Managing your chronic health conditions, especially hypertension, high cholesterol, and diabetes. All of these have been shown to increase risk not only for Alzheimer's disease, but also for stroke. In addition, there's a number of lifestyle strategies that we want to pay attention to. We know that being physically and mentally active, staying socially connected, avoiding head trauma, treating depression, all of these can reduce our risk for Alzheimer's disease.
And Dr. Dick-Muehlke told us about her center.
Alzheimer's Family Services Center is affiliated with the Hoag Neurosciences Institute, and we're very proud to be building a continuum of services all the way from the Orange County Vital Aging Project, which is focused on early identification, through the early, middle, and advanced stages of the disease to provide the direct care, the support, and the education services that people are going to need to cope effectively, to delay institutionalization, to reduce caregiver stress.